good morning. Welcome back to the Broadcast Retirement Network. I'm Jeff Snyder. This is BRN AM for Thursday, October 28th, 2021. And our top story today, oral health and overall health, why you shouldn't delay dental care. Joining me now to discuss this and a lot more, Jamie Dudley is with Towson Dental Care. Jamie, great to see you again. Thanks so much for joining us on the program this morning.
Thanks for having me, Jeff. Good morning.
And it's nice to see you in the office. Last time when we connected with you, I think you're in your home office, but as we can see, you're actually in your dental studio, I guess, getting ready for some patients. So let's kind of revisit the conversation. I want to get your thoughts about what do we need to do for proper dental care, regardless of whether or not you're a young person or a mature person.
Proper dental care is one of the best things we can do to keep ourselves cavity free and have a happy, healthy mouth. And that starts with really good brushing, flossing, and a good diet. You want to make sure that you're properly removing all the plaque that gets on our teeth every day, and then flossing to remove plaque buildup in between your teeth. These are the most basic things that we can do to help keep our mouth healthy.
And Jamie, we're not sponsored by any particular toothbrush maker, but let's talk about the difference between a analog brush, a traditional toothbrush, which we can get in the store, and a automatic toothbrush. There are benefits, but how do you see it? Is it that much of a benefit where you really want to get an automated toothbrush?
Well, first, I would say the most important thing is to use a toothbrush that has soft or even extra soft bristles, regardless of whether you're using some kind of electric or battery operated or good old manual toothbrush. That being said, the electric toothbrushes are designed to help remove more of our buildup, and it's generally designed to help other things like watching the pressure that we apply on our gums and our teeth. So there are definitely benefits to having an electric toothbrush over a manual toothbrush, but the bottom line is making sure that you're properly brushing and doing it at least twice a day, flossing, and going to see your dentist a couple times a year.
So I don't have a toothbrush handy, but let me just go over the stroke. Is it up and down, side to side? How do you protect your gums, even if you're a young person? Am I doing this right? I know we don't have a tool to show this. I don't have anything in my hand, but you should be gentle when you're not scrubbing, right?
It's correct, Jeff. We do not want to apply the elbow grease concept to brushing or taking care of our teeth at all. It's really more the technique. So that being said, you want to get about a 45-degree or so angle with the toothbrush bristles against your gum line, and you want to do lots of little circles, and you can do that back and forth or up and down. But more importantly, making sure that the bristles are a nice angle, 45 degrees, and that you're massaging the gums and the teeth. You want to do this for 2 minutes, twice a day. And that is a basic way to brush your teeth. But there are many ways to do it, and lots of good tutorials online too.
Yeah, but you should not be bringing your gums to bleed. You need to back off because I'm a hard brusher. My wife always correcting me on my brushing technique. Jamie, what are some things to think about as we age? Recession, I think, takes place. I know that I have some. This is TMI for the audience, but I know I have some receding gum line. But how do we protect the gum as well? Is it just brushing and flossing, or are there other techniques?
Well, sometimes as we get older, we need to come to the dentist more frequently. The saying "getting long in the tooth" is somewhat accurate, and that we put a lot of wear and tear on our teeth and things like recession, where the gum lines come up above the root, and that can make for easier buildup of the plaque. It can also make for easier wear and tear, breaking down of the teeth altogether. So I would say making sure that you're seeing a dentist on a regular basis to make sure that you're properly applying all the techniques. Some people need to be on additional special toothpastes or rinses, come in more frequently to get deeper cleanings, meaning that there's getting space around the teeth. And it's important to consistently throughout your life adapt to what is going on. And a lot of times we do tend to get more buildup and potentially a lot more problems because of that. So but same rules apply.
Yep. Well, Jamie, I need to take a very quick break. When we come back, we'll talk to Jamie about how to get your child set with proper oral hygiene. You're going to want to stay tuned right here on BRN AM. Imagine a new television network that will make you richer, healthier, and in control of your financial future. This network is for the policewoman in Nashville, Tennessee, the baker in Dubuque, Iowa, the teacher in Lexington, Kentucky. We want to make the idea of savings and retirement culturally relevant. But what do you see as a defining issue of the midterms, especially for the smaller businesses? I mean, they are the lifeblood of the American economy. Featuring exclusive interviews, current affairs, and docuseries. 33 years old, you retired early.
The philosophy is money only matters if it helps you live a life that you love.
But you got to start thinking about retirement as soon as you get in.
The Broadcast Retirement Network will drive very high engagement with premium partnerships. So this isn't retirement and savings for your parents or grandparents. This is for all Americans. And we're going to change the way you think about money. Welcome to the next frontier of retirement and savings. This is BRN, the Broadcast Retirement Network.
Are you stuck with a low credit score? A credit report and score that's causing you to be denied credit or pay higher interest rates than others for the same things? Then do what Terrence did and call Credit Repaired for your free credit evaluation to help restore your credit.
I started thinking about buying a new house, and my score wasn't where I needed it to be. I called and spoke with one of the representatives, and we just had a good conversation, and I liked what he was saying.
Just one call for his free credit evaluation was all it took to start back on the track to repairing his credit.
I'm seeing the deletions and I'm getting the report, so I know something's being done. It does make a difference to me.
All it takes is one call to get started.
Credit Repair has given me a second chance to have a better credit score.
Don't let a low credit score hold you back another day. Do what Terrence did and make the call for your free credit evaluation.
Call 800-819-4152. That's 800-819-4152. Again, 800-819-4152.
Welcome back. We're talking this morning to Jamie Dudley of Towson Dental Care. Jamie, thanks so much for staying with us this morning.
Thank you. Good to be here.
All right, Jamie, we talked about things we need to be doing, but I have to tell you, there's definitely fear that people have of the dentist and getting their teeth cleaned, and so they may avoid it. And we want to make sure that we get our children on the right path to proper dental hygiene. And I know you're sitting in front of a dental chair, and I can remember squirming a lot, kind of trying to push back as much as I can. Clearly, when you're in a chair, you can't do that. But what are some tips and tricks that parents who are getting their children kind of set up for proper care need to be thinking about?
Great questions, Jeff. So it is really important to set a good tone for the health of your mouth with your child from a very young age. Even when they're babies and they do not have teeth, you can take a little towel and wipe their gum tissues after they're drinking their milk. So from the beginning of their life, we should always be interacting or talking about our mouth health. But as we get older, just showing by example how we brush our teeth and what we do on a daily basis. Reading books with children, making it a very positive experience as they are growing up and, hearing maybe scary stories sometimes. You just want to make this a normal part of their life and make it routine and make it not anything negative, especially in the beginning as they're getting their impressions. And just making sure they understand it's important to take care of even their baby teeth, even though they're going to get adult teeth soon. And again, my one word of advice for parents who are taking their children in for the first time is, again, not using any negative words, using all positive words. Again, reading some kind of fun book, taking them in. And sometimes children will be a little apprehensive, but even just taking them in and letting them sit on your lap a time or two when they're young until they get comfortable enough to have their dental experience on their own.
Yeah, really. I'm sorry, I didn't mean to interrupt you. I was going to say really good advice. And I remember as a child, I'm talking about being a young child, getting there and being a little bit nervous. You see all the tools and you're under big lights and it can be a little nerve-wracking for a youngster who hasn't experienced that. But I remember there was a toy chest. And after I was done my cleaning, I got to pick in the toy chest. Is that still a technique that is used by dental offices around the country?
Yeah, you know it. Absolutely. It's maybe evolved a little bit, but definitely the idea is the same. I just took my 4-year-old son to a pediatric dentist last week. He ironically fell down at school, knocked his tooth out, and needed a cleaning at the same time. So that was our visit last week. And on the way out, they give him a little toothbrush, and they put a token in each of the bags. And the kids go out and they get to decide what toys, like a gumball machine, and they get to decide what they want. So I thought that was a pretty clever update on the treasure box.
Yeah,
but incentive is always great.
Yeah, I remember those treasure boxes. But I like in all seriousness, I like what you're suggesting. I think it makes a lot of sense. Leading by example. So standing next to your child, assuming they can see over reach the sink, but watching what you do. Kids often mirror their parents, so it's important to do the right things in front of them. And then also what you suggested is maybe they come in and watch you get a cleaning, or while they're getting a cleaning, sit on their parents' lap.
Absolutely. And you just feel the personality of the child out, but little steps sometimes. Some kids, it's like they were born ready. Some kids, it takes a little bit longer, but they'll come around. Stay positive, and it should be a delightful experience for the most part.
Yeah, I do recall my brother. I have a younger brother, as you know, and I recall as a child he climbed underneath the dental chair. He was petrified, so my parents had to literally coax him out. That would be the wrong type of experience, and it doesn't have to be an unpleasant experience. It is getting your teeth cleaned. If you have the right hygiene and the right process in place from the beginning, all those scary stories that you hear, they really don't apply.
Absolutely. So, if you don't feel comfortable at the dentist that you're at, or you don't have a good vibe, try another one. But once you get a good fit and you have a good routine, you should be, moving in the right direction.
And last question, Jamie, in terms of the tools we use for our children, I'm assuming they make child's toothbrush, a child's toothpaste. Do they even have child floss? Like, is there a Fred Flintstone? I don't even know if Flintstone's cool anymore, but they used to have Fred Flintstone toothbrush, toothpaste, and dental floss. Is that still the case? Maybe not Flintstones, but smaller tools for the children.
Yes, definitely. They have lots of options now. Children electric toothbrushes are big too. They're the exact same thing as the adult toothbrushes, but made for size of children. Highly recommend them too. They do make kid flossers, usually the floss on a stick, if you're familiar. It's a good way to practice with kids and just get them onto flossing on a regular basis. So they make all kinds of great tools, and they make them for kids too, very young kids.
Well, Jamie, it's great to see you again. Thanks so much for sharing information. Hopefully all those parents out there are getting their children on the right step, off to the right step when it comes to dental health. Thanks so much for joining us, and we look forward to having you back again very soon.
Sounds great. Thanks, Jeff. Have a good day.
That wraps up this episode of BRN AM. Have a topic of interest, someone you think we should talk to, drop us a line. And don't forget, for all the information in retirement, markets, technology, personal finance, so much more, check out today's edition of our daily newsletter, The Morning Pulse. We're back again tomorrow. Until then, I'm Jeff Snyder. Stay safe, keep on saving, and don't forget, roll with the changes.
Waiting here for you to take and drink of. But if you're tired.
Are you being audited and do you owe the IRS $10,000 or more in back taxes? Is the IRS threatening to take more of your money? Don't fight the IRS alone. The Tax Doctor is here to help you negotiate your tax bill and reduce your stress. The IRS can freeze your assets and seize your bank accounts, but you can stop these IRS actions. The Tax Doctor will work with you using our years of experience to represent your case to help you get the best resolution under the IRS guidelines. Help is here to deal with the IRS to reduce your stress. We've handled thousands of cases, so we know what we're doing. If you owe $10,000 or more in back taxes, do not call the IRS alone. Call a Tax Doctor now for a tax emergency analysis.
Call 800-224-6439.